Hey guys, my apologies for this getting up so late this morning. Braxton and I made a really cute video last night with him telling you about lab tests and clinical procedures. And then we got done and we realized that our Wi-Fi cut out in the middle. So we redid it and then it was glitching so bad. So long story short, I was up till about 2 in the morning trying to figure out what was going on with our Wi-Fi. Got up this morning, it's still not working. So I came to the school to use the Wi-Fi. So these are just the problems that I know all of you are facing every day as well. So we'll just get through it. But today we're going to finish up the chapter talking about lab tests and then clinical procedures. There's just a few, not many at all. I have been looking at the calendar and some of the content that we're supposed to be getting through, and I've decided to scrap end of the unit tests. Okay. They were going to be open book tests anyway, obviously, with you guys being at home. But I'm going to just forget those. We're going to finish the chapter today. We're going to do a review activity. And then tomorrow we're going to start a new unit. Okay. I have been like really stressing because there's so much to get through and so little time to do it. And I was really kind of feeling bad and guilty. And then it hit me that we lost 20 days. The governor gave us those 20 days. So when you take out 4 weeks of content, that makes a big difference. So I'm going to try and expose you to as many of the systems as we can, just really quickly, rather than diving as deep as we normally do. If you have any questions about any of that, please let me know. The first lab test we're going to talk about is bleeding time. Okay, and it is just basically the time it takes for a small wound to stop bleeding. Okay, so we've all seen this in real life. We get a little paper cut and it bleeds for a little bit, and then it stops. Okay, we're working in the kitchen, we cut our finger a little bit, bleeds for a few minutes, and then it's done. These aren't the major wounds, major lacerations. Okay, just simple wounds. And a perfect example is when we get our blood drawn. Okay, we get our blood drawn. It's teeny tiny puncture wound. They put a Band-Aid on, and usually by the time you're out of the building, you could probably safely take the Band-Aid off because it stopped bleeding. Okay, so for most people, normal time is around 8 minutes or less. Then we have coagulation time. Okay, and it is a little bit different. Coagulation means clotting, of course. And so we pull out the blood sample, and it's the amount of time it takes for that, for some blood in there to clot. Okay. Usually it's about 15 minutes or less. Then we have complete blood count. Complete blood count is a test that many of you have probably had at some point. If we go to the doctor and they're really just kind of not sure what's going on, they might start with a complete blood count, CBC, okay? But it looks at the number of blood cells. So it looks at your white blood cells, it looks at your platelets, it looks at your erythrocytes, it looks at hemoglobin, it looks at hematocrit and red cell values. Okay, so it just kind of classifies all the different cells and how many are in that sample. Erythrocyte sedimentation rate, this is also called the SED rate. Okay, this is they take the test tube, they put it in the centrifuge. Remember, the centrifuge is what spins it, and allows the blood to settle. Okay, so this determines how quickly those erythrocytes settle down to settle down and separate from the plasma. Hematocrit, one of the other tests, the CBC mentioned that it tests hematocrit. Well, that's kind of hard when we give you a definition that we don't, with a term in it that we don't have the definition for yet. Okay, but hematocrit is just the percentage of erythrocytes within the blood. Okay, so hemato meaning blood. And so it just determines how many erythrocytes are in there. Hemoglobin test measures the amount of hemoglobin in a sample. Some of these are really simple and some of them are a little more complex. Platelet count, again, just counts the number of platelets per cubic millimeter of blood. Okay. The normal level is between 150,000 and 350,000. You'll remember a few days ago I talked about a really scary time with Braxton and that his platelet count was really, really low. And at the time I made that video, I just couldn't remember for the life of me how low they were. Okay. But then between my memory and looking back in some old records, I found it. And his blood count, the very first test that we had, was 7,000. Okay. 7,000. So you can see why his little body was just covered with bruises so badly, because that was way, 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 way below the normal. Okay, 150,000. Red blood cell count, of course, counts the number of erythrocytes, and that norm is between 4 and 6 million. White blood cell count, there's a lot less white blood cells in blood than erythrocytes. Okay, makes sense with the color of our blood. But the number of leukocytes is usually between 5 and 10,000. Okay, so much, much lower. And remember that leukocytes are what fight off infection. Okay, so if the doctor suspects that you have an infection of some sort, they're going to order a white blood cell count. Okay, when we see that that white blood cell count is elevated, then we can assume that there's some sort of infection, some sort of antigen that is really flaring up those leukocytes. Okay, that's all for the lab test. Then we're going to get into, I think, 3 clinical procedures. Aphoresis is the first one, which, as you can see, they're in that picture, they're drawing blood out of the donor, and then they separate it into the component parts. Okay, so they put it in centrifuge, separate it into the component parts, and then they remove a certain part of that blood. Okay, so they might take just the plasma, and then the rest of it is donated to or put back into the donor. Okay. Blood transfusion. This is where we take whole blood cells. They're taken from a donor and then infused into a patient. Okay. This is something that we probably hear, not a ton, but we hear people talk about having blood transfusions. Okay, I sat with my grandma towards the end of her life through several blood transfusions. Okay, but basically all that blood is taken out and infused into a patient. The last one we're going to talk about, and probably the most painful, is bone marrow biopsy. Okay, you can see in this picture, in the bigger square, you can see exactly what's happening in the smaller square. So you can see that the needle is being put directly into the pelvis to draw the bone marrow out. Okay, it's used for different types of diagnosis. It's used for anemia, leukemia most often. Okay, it can also be removed using a syringe. When you stick a syringe in something and you pull back, it creates suction. Okay, and so then that's called an aspiration. So in this case, it's called a bone marrow aspiration because you're drawing that bone marrow out. In other cases, like I've been involved in many, many cases where we aspirate a knee. Okay, so you're putting that needle in with a syringe. You're using the suction that it's creating to draw that fluid out. Okay, so that's like a joint aspiration. So there's a little on that. Okay, like I said, that's the end of the chapter. I'm going to have you do a review activity, and then tomorrow we're going to start fresh with a new unit. I hope you all are doing well, and let me know if you have any questions or anything that you need from me.